Hi folks, welcome to Demystifying Medicine channel. In this video, we're going to have an overview on the Idiopathic Pulmonary Fibrosis disease, or IPF for short, and we want to discuss what do we really know about this disease. In this video, we will answer the questions including what is pulmonary fibrosis, how does it occur, and basically what are the possible symptoms and treatments associated with this disease. Pulmonary fibrosis is a chronic restrictive fibrotic lung disease. Well, I know, it's a little bit confusing. But in simpler words, pulmonary fibrosis is an inflammation and scarring to the lung tissue. So far, there are more than 200 different types of this disorder with a variety of causes, and basically the word idiopathic was stemmed from the Greek language with the meaning of unknown. Therefore, the exact cause of this disease is still unknown. This chronic disease primarily occurs in older adults within the age range of 40 to 70 years old and mostly in male smokers. Doctors usually suspect individuals with pulmonary fibrosis disease when they show symptoms such as chronic dry cough, shortness of breath, loss of appetite, tiredness, weight loss, and a diffuse pain in the chest. In advanced stages of this disease, one can experience the shortness of breath without physical effort and bluish coloration of the lips, nails, and sometimes the whole skin. Traditionally, doctors rated the diagnosis as early, mild, advanced, or severe. However, researchers are working to narrow down the precise measurements of the disease in order to better identify it. The stages of IPF include stage 1 or mild stage when the symptoms are not shown or are presenting as mild coughs or shortness of breath. Stage 2 or moderate happens when the symptoms has become severe enough that the patient probably needs to use breathing medications or oxygen machines, and basically the oxygen levels is low throughout the whole body. In advanced stage or stage 3 of the disease, the severity of the symptoms would barely allow doctors to treat the patient except the lung transplantation. However, not everyone can be a proper candidate for the lung transplantation procedure. In a person with healthy lungs, the gas exchange occurs in a way that we inhale oxygen and exhale carbon dioxide. The small air sacs within the lungs, which are called alveoli, are surrounded by important cells such as epithelium, macrophages, and fibroblasts. When oxygen is inhaled, it goes into the bloodstream and gets carried by red blood cells. When the small particles of the smoke or air pollution get inhaled, they can cause micro-injuries to the alveoli or epithelium cells, and these injuries would trigger the cells to produce inflammatory molecules. Therefore, the inflammatory molecules would cause the fibroblast cells, which are located at the surrounding of the alveoli cells, to do multiple differentiation, and it would finally lead to damage or loss of lungs capillary surface area and gas exchange units. Consequently, it would result into poor gas exchange and shortness of breath and other complications associated with this disease. It has been identified that genetics is an important risk factor in the idiopathic pulmonary fibrosis. Usually when 2 or more members within a family have IPF, it is called familial pulmonary fibrosis. However, family members can be secondary as well, such as aunts, uncles, cousins, and etc. In some families with familial pulmonary fibrosis, or FPF, not every affected family member have IPF. Some of them can be diagnosed with IPF and others could have another type of restrictive lung disease. The average survival rate from the time of diagnosis to the advanced stage of this disease is about 3 to 5 years. Currently, there are 2 drugs approved by FDA for the treatments of this disease, which include pirfenidone and nintedanib. These medications would basically help the patients to decrease the decline in their breathing test results. However, these medications would not necessarily make the patients to feel better, but they decrease the spread of the breathing problems in IPF patients. The side effects associated with these medications include impacting liver function but not severe enough to lead to major health problems. However, it is recommended to perform blood tests for the liver function every month for the duration of 6 months and then every 3 months after that if everything remained stable. The other side effects for both medications include GI side effects, which means the digestive system doesn't feel right, and it usually comes with the symptoms such as nausea, vomiting, and diarrhea. Therefore, it is recommended to take the pills with food and evenly spread the doses throughout the day. Another side effect associated with these medications are photosensitivity rash, which are rashes that appear with the exposure to the direct sunlight. Therefore, patients who take these medications must be cautious while being in the sun by wearing long sleeves outfits, sunglasses, hats, and more importantly, sunscreen. Finally, I must say that despite the fact that IPF is a chronic progressive disease, but IPF patients can manage their disease as fully as possible. In order to do that, there are some steps to take. Step 1 is to learn as much as possible about IPF and their specific diagnosis by referring to accredited medical resources. The second step is having family members or friends to attend their medical appointments, as they can be a second set of ears and help the patient with their daily activities. Step 3, and the most important step, is to remember that you are not alone and reach out to your doctor or pulmonary fibrosis support organizations for more help. Thank you everyone for watching, and don't forget to subscribe in the Demystifying Medicine channel.